I'm the director of planning here at Texas Homeless Network, and I work a lot on various initiatives around the continuum of care, but I'm really excited to talk today about SOAR, what that stands for, why it's important, and why and how you should operationalize it. So I'm going to turn it over to my colleagues here at THN, and then we also have some technical assistance experts from SAMHSA who will introduce themselves, and then we'll go ahead and get started with the slides. Hope?
Hi there, my name is Hope Rogers. I am the COC Performance Manager with Texas Homeless Network. Excited to have the opportunity to speak to you guys today a little bit about SOAR and how you can fund it. So I will pass it over to Sumitra to introduce herself.
Hi, good morning. My name is Sumitra Pocoto. Sorry, I would join you on camera, but it's not letting me. But I am from the SAMHSA SOAR TA Center. I'm the TA Center liaison to the state of Texas. And so I'm really excited to be able to talk to you all and have a conversate with you all today.
And then I think last but not least, the man who makes this whole thing work, Craig Fierro. Craig, you want to introduce yourself?
Hi, everybody. I'm Craig Blaze Fierro. I am our COC Programs Coordinator, and I will be your host for today.
All right. Well, with that out of the way, Hope, would you mind dropping the PDF version of the slides into the chat, and we'll move us into the agenda. The hope is that today, one, you're definitely going to hear from the experts with SAMHSA, or the Substance Abuse and Mental Health Services Administration, about SOAR, SSDI and SSDI, the SOAR model, the effectiveness of the SOAR model, how to get started with SOAR. But then we're also going to talk about how to leverage the SOAR model in your supplemental NOFO application, and how to get the most for your participants and your agency out of this opportunity. So if you don't know what I'm talking about with all that stuff in the second bullet point there, we'll get to that a little bit later on in the presentation. But first, I'm going to pass it over to Sumitra and Lila to talk more about SOAR. And so Sumitra, just let me know whenever you need me to advance the slides.
Sure.
Well, I guess before I do that real quickly, I do want to talk just kind of briefly about the supplemental NOFO. I apologize. So that supplemental NOFO, it's $322 million available to assist communities with unsheltered and rural homelessness. There's $67 million available in the balance of state continuum of care, the Texas balance of state continuum of care. And it requires a comprehensive plan at the COC level to serve individuals and families experiencing homelessness with severe service needs. And the COC and HUD require individual project applicants to align with this larger kind of community plan at the project level. So that's when I say we'll talk about that more a little bit later, that's what we'll talk more about. And now I really will hand it over to Sumitra to talk more about SOAR.
No worries. Oh, there's my video. Hi, everybody. Thank you so much, Jim, Craig, Hope. Welcome to everybody that's on the call today. I'm really super excited to be able to kind of have this conversation with you all today. I'm joined by our wonderful Texas SOAR State Team Lead, Lila Ordonez, above, who will also be engaging in our conversation today as well. So just very briefly, I know I introduced myself already, but just again, I work at the SAMHSA SOAR TA Center. So this is the national TA center funded by SAMHSA to be able to help train and be able to provide TA to different states, communities, agencies, all the way from the systems level, all the way down to the individual level with their SOAR initiatives that might mean helping them to grow it, develop it, sustain it, whatever that individual community may need. Each state has their own specific liaison. And so I am I'm the liaison to the state of Texas. I've been in this role for about 7 or 8 months. I feel really honored to be able to share with you all today about SOAR and how it can be a valuable resource to the populations that you serve. It's especially, it means a lot to me, especially because when I took on the role to be the liaison to the state of Texas, Lila and I, we kind of sat and we really kind of looked at the current status of SOAR within Texas and looked at, who are the populations and who are the communities that we are missing, right? Like who is out there that could really benefit from this and has not been reached out to, or that there are gaps in the service. And one of the first types of populations that we identified were rural communities, and how from our perspective, from our systems level, really kind of strategizing and looking at how can we help expand access to this service. We know that rural communities face a number of different barriers. You all are a resilient group, but you face a number of barriers. And I think especially when it comes to the topic of homelessness, oftentimes when you hear the word homelessness, a lot of us automatically have this image of, a person in an urban community pushing a cart or sleeping on a bench, right? But really, like when we think about our rural communities, and when we think about how there are really typically higher levels of poverty in rural, well, I should say non-metropolitan areas, really kind of looking at how homelessness exists in our rural communities. It may look differently, right? We don't think of homelessness as the person who is sleeping in, the campgrounds, or moving from motel to motel, right? Or things like that. But really kind of looking at homelessness in our rural communities, and how SOAR can be a tool in helping you to potentially reach your overall goals in helping to reduce rural and unsheltered homelessness. Next slide, Jim. Sorry, I love to talk about SOAR and this topic in general, so I'm going to try my best to not ramble on this call. But what I do hope to be able to just discuss with you all today is I really would like to share again the importance of income supports such as SSI and SSDI, and really kind of talk about how you all as a community, as a COC, can become SOAR trained, and how it can help you with your overall goals that you hope to achieve with this special NOFO. Next slide, Jim. Thank you. All right, so let's kind of set some context really before we kind of dig in, right? And really kind of looking at what is SOAR. Now, SOAR, we at the TA Center, we have had a really great relationship with the Texas Balance of State for a number of years. So many of you on this call, you might be familiar with SOAR, you might have heard of it, even if you're not super familiar with what all it means, you've most likely at least heard of it, right? And maybe there are a few people on this call that are like, I don't know what that is, I don't know what the hell you're talking about, right? So I will say first and foremost, the main thing to be mindful of in this conversation, when we say a SOAR application, SOAR is not a separate application from a traditional SSI, SSDI application, because SOAR is a model. SOAR is a model in which we train caseworkers, or whoever's doing the work. It doesn't have to be caseworkers, it could be peers, it could be volunteers, whoever, but I'm going to say caseworkers. But it's a way of training caseworkers to be able to put together a comprehensive disability application. Okay, so I'll say it again, it's not a separate form or anything from your standard SSI, SSDI forms. It's the way in which they are putting that entire claim together. So when we're referring to SOAR, SOAR is a model, and what it's referring to is a complete application. Okay, it is this model is designed for individuals that are either experiencing homelessness or are at risk of homelessness and have a serious mental health condition, a co-occurring substance use disorder, and or other physical disabilities. As I stated before, SOAR is a national initiative. We're sponsored by SAMHSA. We've been sponsored by them in collaboration with the Social Security Administration since 2005, and it's national. All 50 states and Washington, D.C. currently participate. Next slide, Jim. Thank you. So just in terms of some basics, and don't worry, we'll kind of get more into like what makes SOAR different, but just with some place setting. So with SOAR, right, because we kind of started this conversation talking about some of the barriers, right? Some of the barriers to individuals being able to access benefits in rural communities, right? And you all are out there in communities, you're doing the work, right? You could probably sit here and tell me I don't need to lecture you, but just with the isolation, with homelessness looking like an invisible problem, with access to resource, with access to infrastructure, all these barriers that kind of come together to make things difficult for a person who may be trying to apply for benefits, right? SOAR is a model that is really, it was really kind of, long story short, but it was born out of this demonstration study in the 90s where you had the social worker and you had the SSA office, and they were looking at, well, we've got these increasing numbers of homelessness. What is making it so difficult for this population to be able to access this tool? right? Like, here are these tools here. We've got these programs, SSI, SSDI, that could really kind of help improve this person's life, right? And what is making it so difficult to access that? And so from that study, they identified a number of barriers. And from that is really where like the SOAR model started to become formed. But really, I hit on that point because the main thing there is that, you know, the reason why it was so important for the study to be done and to really kind of formalize into what is now known as SOAR is because of this view of accessing benefits and or income supports. We could just say income supports in general, because that could also be employment, but really looking at how like income supports can be a life-saving tool. And I could say that as well as a person with lived experience with homelessness, that is a tool that can truly be life-saving, and really kind of looking at how helping individuals that are experiencing homelessness or at risk of homelessness be able to obtain benefits to really kind of help stabilize their lives. And we'll talk a little bit more about that. When we talk about the SOAR model, SOAR trained caseworkers help individuals apply for two of SSA's disability programs. One is SSI and the other is SSDI. These programs are they have a lot of similarities, but they have some key differences, which I have listed there on the chart. We won't go like super in depth into this, but kind of the main point to know is that SOAR trained caseworkers help individuals apply for these two programs. We'll talk about SOAR training a little bit later, but as part of that training, you know, what you all need to know as decision makers in your agency is that SOAR trained providers, while they do assist individuals with putting together complete applications, sometimes there can be this pressure to feel like they need to be this expert on all things Social Security, and that's not the case. In the SOAR training, you know, there are courses and modules that are taught basic concepts about Social Security, things that they need to know about the eligibility process, about definitions, things like that. These basic things that they need to know to be able to put together a good application, but they don't necessarily need to be able to be this expert in all things Social Security. Next slide, Jim. So if we were all in a room here together, one of the questions I really like to ask is, what do you think the current approval rating is for an SSI application? First go around, somebody applying on their own, 60%. Thanks, Craig, for putting that in the chat. I was gonna say if people want to put it in the chat. Oh, I love it. Y'all are engaged. I'm seeing a wide range: 60%, 15%, 25%, 35%, 15%. Yeah, so we're kind of all over the map. So currently, the approval rating for an SSI application, first go around, no help, it's actually at about 29.8%. And that has actually gone up over the past couple of years. However, when you take those SSA reporting tables and you filter for an individual with a severe mental health condition and experiencing homelessness, that number does indeed drop to 17%. So think of the populations that you all serve in your agencies, the staff that, you know, the populations that your staff serve, 17% chance of that person getting an approval. And oftentimes what we found from tracking with studies, oftentimes it's not that these individuals don't have severe conditions that put them in the category of disabled. It's often that that information is not accurately reflected in those disability applications, right? Think of the populations that we serve every day, right? Think of us as we're interacting with them, right? We often are able, because we're interacting with them on that level, we are able to observe, to see, to hear from them what those severe impairments are. However, how often do you think like that information that we all have actually gets reflected within those disability applications, right? And oftentimes it's not, because think about it, when somebody's applying often on their own, there are often so many barriers that get in the way, right? First and foremost, SSA primarily communicates by mail. If the person doesn't have an address or they're transient, moving around a lot, they're probably not going to get that mail, right? If we have a person that's experiencing severe cognitive impairments, maybe they're not able to remember where they were treated at, right? Maybe they're not able to give that complete information, right? Maybe they're unsure. So there are just so many things that get in the way of really being able to demonstrate this information on these applications. Oftentimes when, especially from my experience before I was SOAR trained, when I would attempt to help people with disability applications, a lot of the times the conversation would focus on, well, I have this diagnosis, right? I'm diagnosed with schizophrenia. I'm diagnosed with epilepsy. I have seizures. I should be eligible, right? Blah, 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 right? And so when we have that mindset, a lot of the times when we're helping someone apply for disability, they're like, well, I can get something from my doctor that says I'm diagnosed with schizophrenia, right? That's all I need, right? We include that, there you go. Or we tell Social Security, this is his doctor, there you go, right? But think about this for a second, right? Simply having a diagnosis in and of itself does not mean that somebody is unable to work or unable to function, right? I mean, most of us most likely know that, right? Like a diagnosis in and of itself does not mean that somebody is severely impaired and cannot work, right? So oftentimes we have to kind of move away from this mindset of that it's all about having a diagnosis, that we get approved for having a diagnosis, right? And that's kind of what the left side of this chart is showing you, that, right? There's this focus on like medical condition. And while yes, it is important that the person has a medical condition, SOAR really aims to train caseworkers to take that, but then make the link to functional impairment, right? So really kind of showing, okay, here's this person's diagnosis. This is how it has severely impacted their ability to function, because that is what a person would get approved for disability for, is they have demonstrated their conditions are so severe that they are unable to function in a work environment, right? I could be diagnosed with epilepsy and Jim could be diagnosed with epilepsy. And this isn't to minimize anyone's experience with that. But Jim may be either getting treatment or whatnot, that where he only experiences seizures maybe like 2 or 3 times a year. Now that's still serious, but when we're looking at impact on that person's ability to function, okay, 2 or 3 times out of the year, all these other days you're relatively able to function, versus maybe me, I'm diagnosed with seizures. I experience them 2 or 3 times a week and I have to have aids on my bed because I have fallen out and have caused severe injuries 3 times out of the past month. Do you know what I mean? So like just kind of throwing that out there, that really kind of looking at SOAR, really that part of that SOAR training is really kind of showing caseworkers how to make that link between here's the person's diagnosis and here is how it severely impacted their functioning. That is what is often missing in many of the disability claims that are put in. Next slide, Jim. Thank you. So, so as we're having this conversation, I'm sure many of you are thinking, okay, that's great. Like, where does SOAR come in? What makes SOAR unique? So as I stated before, a SOAR assisted application is really about putting together a complete application, right? I know that thinking of the traditional way that we help somebody apply, and this isn't like, I'm not throwing shade. This isn't like being funny, but like, most agencies, when they're attempting to help someone to apply for disability, most caseworkers, they want to be helpful to someone. So if someone needs income or they want to apply, they're most likely going to help that person schedule an appointment to, go down there. They might give them a bus token, say good luck, and then that's it. Let me know what you need. And then that's it. But with the SOAR process, SOAR providers are trained to be able to walk with that applicant through the course of that application. And when I say that, what I'm referring to is we have 5 critical components that make up a SOAR application. Okay. So again, you're using the same standard SSI, SSDI like application forms, but these are the components that are going into the process of it being put together. So I'll briefly go through them. I won't like ramble too much, but the first is that the SOAR provider is the person's appointed representative for that claim. Now, that doesn't mean that, the SOAR provider then makes all of the decisions. It means that they are able to work together with that applicant to fill out those forms. It also grants that SOAR provider special permissions, such as being able to submit evidence for that person's claim, be able to call and get information about it, be able to call any of the SSA reps or DDS reps to get information about that claim, be able to attend appointments with them, able to attend appointments on their behalf. I recall showing up to ALJ hearings and the judges weren't allowed to dismiss the case because even though the client didn't show up, the representative was there, right? So again, really like having somebody there that's like serving as that liaison, that link between the applicant and the SSA office to kind of make sure that the claim's being put together well, that it's moving through the way that they should. The second part is the collection and submission of appropriate medical records, right? Because again, as I stated before, think about it. Really, part of being able to prove that an applicant meets, the requirements for disability is really showing like their limitations and functioning. And so as part of the course, SOAR caseworkers are trained on how to like identify and collect appropriate medical records and how to know what medical records are appropriate. The third is writing a medical summary report. Now, this is not a clinical document. but this is just a report that really kind of provides that supplemental information about, again, like I keep saying it, but like making the link to functioning, right? So maybe, you know, on a clinical record, you know, the doctor might have indicated that this client has issues with memory, right? And the medical summary report, the SOAR case manager might be writing down, might be including supplemental information to back that up, because again, you have to demonstrate the functioning. So they might be talking about how the applicant missed 5 of their last appointments because they couldn't remember, or that they got lost last week because they have difficulty remembering the bus schedules. You know what I mean? Like really being able to provide that supplemental info to show that functioning, because again, clinical records are extremely important in this process, but they do not always tell the full story. The fourth is, if applicable, getting a co-signature on that report from a treating provider. And fifth is some kind of quality review of that application before submission. That can look a number of different ways. And what we found from tracking is that applications that use all 5 of these critical components are significantly more likely to be approved. Next slide, Jim. Thank you. So these are our SOAR outcomes. So now compare these with that conversation we just had about the 17% approval rating. So these are our 2021 outcomes. We're finalizing our 2022 outcomes this week, actually. So these are our, so not to confuse you. So on the bottom row, these are our cumulative outcomes. So these are for everyone nationally. Since we've been tracking since 2007. So from 2007 till present day, we're at a 65% cumulative initial approval rating. For SOAR assisted applications. The top row are specifically 2021. So that's from a period of July 1st, 2020 to June 30th, 2021. And again, we're finalizing 2022 outcomes this week. So for last year, we're at a 60% approval rating. It's down a little bit from the national average. COVID has had a lot to do with that, because that was the first kind of full SOAR year with COVID impacting a lot of the processes, but still comparing that 60% approval rating to 17%. The state of Texas as a whole is a little bit under the national average. I believe I was looking at 2022 numbers this week, and we are at about 52%, I believe, in the state of Texas on a total of 200 something applications. I should have checked the full numbers again this morning. My apologies. But so again, comparing those numbers to that 17%. Can you go to the next slide, Jim? Thank you. And really even kind of looking at, you know, the outcomes, like of the financial outcomes from these approvals, right? But really kind of looking at how helping a person get linked to federal benefits, such as SSA, has a number of financial outcomes for on a state and local level. So really kind of looking at this slide shows the different ways that this manifests. 100%, Jim, significantly better than applications with no assistance. I agree. So looking at the average general assistance reimbursement, the average Medicaid reimbursement, the average retroactive back payment for those individuals. Next slide, please. So as we're kind of talking about like the benefits of getting a person linked to income supports, it's really truly like a win-win-win for everybody. And, you know, first and foremost, thinking of the individual themselves, right? And really kind of looking at, so, you know, if a person gets approved for SSI, currently for 2022, the maximum amount that they could get is $841. Some states add on a supplement to that. I don't believe Texas is one of those, but I will check. But, you know, at $841, like that's not a lot. That person certainly isn't rich, but like really kind of looking at, well, comparing that to zero income, but also looking at the other benefits that surround that, really kind of helps to show why like helping a person get access to income really can help be the foundation, that brick in that person having and starting to work on having a more stable, productive life and as a stable member of our communities. Of course, like this can manifest in a number of different ways, but some of the ones that always stick out to me is, you know, the main hope is, you know, with income, that the person will have an easier time being able to either obtain or maybe maintain affordable housing, depending on their situation. I think it's really, really important, especially in the state of Texas, which is a non-Medicaid expansion state, to look at, I didn't even mention this on the other slide, but when a person is approved for either SSI or SSDI, there are associated health insurance programs with that. So if a person's approved for SSI, they are then eligible for Medicaid. If they're eligible for SSDI, they're eligible for Medicare. So really kind of looking at how helping an individual get linked to these benefits can also bring along associated health insurance, which we imagine, at least looking at statistics, helps to show greater engagement, obviously greater access to treatment, but greater engagement in treatment, decreases in incarcerations and hospitalizations. And when we're looking at homelessness as a whole and reducing homelessness, really looking at, how the social determinants of health are all interrelated, right? Like we know this, that they are all interrelated. And so really kind of looking at whole person health and looking at how having that person have greater whole person health, is likely going to lead to that person being able to maintain that housing and reducing homelessness. And also too, I think it's important to mention as well that, I always say, like, SSI, like getting access to these benefits is really just like can be the first step in helping that person get stable, because once they are approved, there are a number of different post entitlement. I'm sorry if I'm using a bunch of acronyms or words that you're familiar with, let me know in the chat. But once the person has been approved, SSA does have many, many different work incentives for individuals to try out work and still be able to maintain their check. There are opportunities for people to be able to save money and put it away for different education and employment opportunities. So there are a number, we don't have to, there's often this myth that, like, once an individual is on benefits, they're just always going to be on benefits, right? Like there's so many kind of incentives and opportunities there that people could be able to go on and whatever their ideal of living a satisfying life is, that income is there to be able to assist with that. Next slide. Thank you. Again, I also like to point out that I said it was a win-win-win for everybody, right? So also mentioning how states and communities benefits, and I already kind of mentioned this, but SSI and Medicaid bring federal money back into the states. I also think too, like, especially like looking at like from a COC level, really kind of thinking about, there are a number of different system performance measures that you all have or may be working on. And really, I really encourage you to like just kind of think about and reflect on, does a person having income help make many of those other system performance measures easier to obtain? We could probably all agree, yeah, right? Like really kind of looking at, there are a number of different performance measures, but helping an individual get access to income, reducing homelessness, like all of those kind of things, that oftentimes helping a person get with income can help that. Next slide, Jim. I see all the comments in the chat. Great, thanks everybody. So, I do want to kind of talk a little bit. I'm being mindful of the time. It's close to 12:30. I do want to talk a little bit about in terms of getting involved with SOAR and what that looks like. So, in terms of thinking about this process, you might be thinking like, great, I see the value of it. Like, what does this really look like operationally, though, right? The first step typically for a provider or an agency to get involved with SOAR is SOAR training. Now, back in the day, SOAR, those of you who may have been around for a while, back in the day, SOAR did like in-person trainings, right? So we at the TA Center would train people who would then go back to their communities and train people. But what we found is that, people were getting different information, they were getting different experiences, because of course it depended on who your trainer was. So SAMHSA really kind of pushed for a standardized training for everybody back in 2007, I believe. So SOAR training is now done online via a standardized online course. It's a SOAR online course. It's free. There are 20 free CEUs. If anyone's a licensed social worker or has staff that's licensed social workers, they can get 20 free CEUs, but it is a comprehensive course. Like I said, we estimate it takes about 20 to 30 hours. And this isn't one of those courses you put on in the background while you're actually doing laundry. Not that I have ever done that, of course. But it's a comprehensive course. They are given a practice, like a fictional client. And as they're going through the classes, they're actually filling out like fictional, sample forms, like as if they were filling out an actual SOAR assisted application. So we do estimate about 20 to 30 hours for that training. Beyond that, we do estimate for real life applicants that we estimate approximately somewhere between 20 to 40 hours per complete application. This is over the course of 60 days. Don't let that scare you. I know it sounds scary at first. This is over the course of 60 days. And this is like talking about like total process from like beginning to end. And I know the 20 to 40 hours is a pretty wide range. It really depends, if you're questioning that, it depends on the type of setting that your agency is. If you're in a setting where, you know, you have easy access to the applicants, such as like a hospital, or a legal setting like a jail, or like a residential setting. Like if you're in a setting where you have like easy access to them, or if you have other easy access to parts of the process, like having in-house medical staff, easy access to records, things like that, you're likely going to be on the lower end of the scale. If you work in a setting like I did at a recovery center, where I was going out and like looking for people in parks and things like that, where if you're in a setting where you're going to have that high level of engagement needed to get this done, it's probably going to be on the higher end of the scale, closer to the 40 hours. Can you go to the next slide, Jim? Almost there, everybody. We're almost done, I promise. So we do want to talk a little bit about just community collaborations and examples, because SOAR cannot exist in a vacuum. It's only successful really because of different community collaborations. And we really wanted to kind of talk to you guys like really briefly, or just at least kind of present, you know, some examples of how this can work. Because again, I know oftentimes in rural communities, you know, there's often less resources, less infrastructure than some of the urban areas, and really kind of thinking about like, well, how can we do this? So we kind of want to talk to you about some examples. Lila, did you want to jump in and talk a little bit about Houston? If not, I can go ahead and give some other examples. Okay, so one of the examples that I wanted to talk about. Oh, sorry, go ahead, Lila. No, it's okay.
Sorry about that. I was trying to just keep on clicking buttons there.
You're good.
Yeah, good morning, everyone. So yeah, some of the community collaborations like here in Houston, for example, our COC, Coalition for the Homeless here, what we have done is we have actually have 3 agencies that are collaborating together with the SOAR initiative. So we have, and just in case any of y'all, are familiar with some of the agencies here in Houston. So we have Avenue 360, Health and Wellness, which is the agency I work out of. And then we have Search Homeless Services. They are one of the leading agencies here. And then also we have Healthcare for the Homeless. So we're all collaborating together to provide healthcare and provide also, like I was saying, the expansion of SOAR workers in order to really tackle helping our population, our homeless, literally homeless individuals in attaining their Social Security benefits. Now, how that came together was we were able to access COVID funds, and that's just one funding source there that we were able to tap into, and then be funded across these 3 agencies. The agency, again, that I work for, Avenue 360, was able to, we actually formulated our first expansion here, and we expanded by, I have a SOAR navigator, and I might use a couple of terms here that are unfamiliar, but so a SOAR navigator. And so she basically takes in all our referrals from the COC, and then also internally, and then from community agencies that do not have a SOAR program. We also have 2 case managers that were added onto this program. And so we're able to try to assist as many internal and external clients. Search Homeless Services, and I just kind of want to walk this through to help y'all see the possibilities at hand. They were able to add 8 individuals to their team. And so, and they have plans to also try to grow more by adding more individuals. So that's exciting. And then Healthcare for the Homeless. They're actually right now hiring for another spot. And so they were able to get their program just really ramped up and get it started. And so the good thing is as well is that Avenue 360, we have a clinic here, and so on site. And so we're able to assist our clients by sending them right upstairs to access any mental health services, and then just physical health services. And so we're able to tap into directly to our Epic system to get those medical records. And I'm sorry, y'all, I don't mean to be so wordy, but I just kind of get into the process in my head. And so, so yeah, and really get the foundational information we need to get these cases rolling and get them rolling at expedited through our contacts with SSA here locally, and then also the contacts that we've really built out throughout the state of Texas. So those are just crucial in really making this happen. And then, yeah, we're able to share resources amongst the other two agencies. We're able to go through Healthcare for the Homeless, who is pretty much an open door to our homeless population here in Houston. And there's nothing is charged to the client. And so, yeah, and so we're all able to help each other and support each other, not only through, you know, having monthly meetings to see where the needs are and how we can better support each other, but also in the fact that if one agency, for example, Search does not have a clinic, and so we help each other out by them referring individuals to us. So that way we make sure, okay, this individual does not fall through the cracks. They're being serviced at least one of these three agencies, right? So again, I've been doing SOAR for about 8 years, and so I could speak SOAR all day long. So I'm sorry if I just kind of ramble on here, but so yeah, so SOAR is a great initiative, and it really is. I've seen the process from the beginning, not just with growth in the community with SOAR, but also with working with the COC and having agencies that come to the table, and we really try to look through, you know, and see what the challenges are, the needs, all the way from the, you know, perspective of the client, of the individuals out there needing our assistance, all the way to top management at the county, for example, the county system. So, and we have Harris Center, we have Harris Health here. And so we're able to bring them to the table and really, you know, just let them know what our needs are with our population. And so, yeah, so it's really all about that communication and making those relationships and going from there. So I won't keep y'all much longer, but thank you so much, Sumitra.
Yeah, no, thank you, Lila. That's great. Sorry, Jim, 5 more minutes, I promise. But another example that I just want to throw out there really, really quickly, because Houston's doing some amazing things, but I'm sure many of you are probably sitting there like, "Oh, they're so big," right? So I just wanted to throw out an example of a more rural community. So looking at the state of Nevada, now Nevada has 17 total counties. 88% of the state's population lives in 2 out of those 17 counties. Like, no lie, that's a real statistic. 88% of the state's entire population lives in 2 counties. So as you can imagine, those 15 other counties are really, really rural. So Nevada was one of maybe like one of the first states, like when SOAR, like in its standardized form, was first officially rolling out. And they were participating in like those 2-day live trainings that I was talking about. And oftentimes individuals would go in there, they were really, really excited about SOAR, but there really wasn't any kind of like infrastructure like in place to really kind of have SOAR be successful in the state. You know what I mean? So people would be really, really enthusiastic about going to the training because either they cared about SOAR or they thought it was something helpful. Do you know what I mean? But there often wasn't anything to sustain that momentum when they returned back to their community. Many of them were volunteers, things like that. So from the few people in the state that were doing SOAR regularly, and from the great outcomes that those few people had, they were able to receive some CABI funding in 2014, where they were able to fund a SOAR coordination and benefits specialist. Sorry, my phone's ringing. They were able to fund like a SOAR coordination and benefits specialist who was able to kind of coordinate SOAR efforts within the state and kind of bring them to where they are today with a number of dedicated positions. But when I was talking to one of the individuals from Nevada, we were having this conversation about rural communities. She kind of pointed out some key things that she thinks are key for being able to build and sustain like quality SOAR programs in rural communities. And she kind of pointed out collaboration and really kind of looking at like systems level support. In Nevada, what that looks like with statewide support. Here in Texas, at the balance of state, what it's looking what it's looking like is support from this COC, and basically having this commitment to utilizing SOAR as an intervention. In Nevada, what they did was they adopted like this statewide strategic plan on ending homelessness. And they really kind of all came together and decided that they were going to utilize and prioritize SOAR as an intervention. So really being able to collaborate with all local stakeholders, buying into this plan and planning in advance with everybody kind of coordinated together on this effort was helpful. She also talked about like connection, right? Because oftentimes with rural communities, things can feel really, really distant. And she talked about how having the SOAR online course be standardized online now really kind of helped bridge the gap, the technology gap, the distance gap. Having the online training is there as something providers can always use back to refer for information, a really accessible real-time tool. But often too, she talked about like the consistency of that and really kind of making sure that putting little pieces into place with making sure that like everybody is hearing the same message no matter where they are in the state. So no matter where they are in Texas, whether they're in a rural community area, whether they're in a big metropolitan area like Houston, really being able to have the same message. So having standard submission processes for SSA and DDS, having standard fundamentals training. And in the state of Texas, SOAR cases have a specialized unit at DDS to handle those cases. And then lastly, she kind of talked about like communication. So really kind of looking at the little ways to really kind of enhance communication, because again, we're talking about this message of connection and consistency. So for them, they publish like a quarterly newsletter statewide, right? But that could also look at, hey, is there an email list or a listserv, or is that the COC that, you know, talks about SOAR once a month? Are there like regional meetings? Are there, do you know what I mean? We're really kind of looking at, you know, so all these components really kind of, as you all continue to have these discussions and go along with talking about how to best implement SOAR, really kind of looking at how these little things can help make this process doable in these rural areas. Looking in the chat box, they utilized CABI funding, CABHII. Hopefully I spelled that right. Next slide, Jim. I'm going to breeze through these last two for y'all. The one thing that I do want to make sure that I mention as well, so in my role at the TA Center, I mentioned before, I'm the TA Center liaison to the state of Texas. In terms of the support in TA I can provide is almost unlimited. What's listed here on the slide are some of like our national TA events. So we do like monthly webinars, we do e-news, we do swing over lunch calls where anyone can just call in and ask questions for an hour. It's like rapid fire. We've got tools and things in our library. But thank you, Craig. Thank you. I spelled that completely wrong. But the one thing that I want to make sure that I impart to you all is that I'm here as a support regardless of the level of support that's needed. That could be from a systems level, such as coming to talk to you all here today. That could be from an agency level, like reviewing different tools or maybe things that you think would be helpful. That could be on an individual level. That could literally be somebody emailing me saying, where do I find this form, or what does this question mean? We are here to provide that support, even with training, being able to train in cohorts, things like that, no matter what it is, that I'm here to help you all be successful and be a support to you all. Next slide. So lastly, just in terms of some next steps, I really kind of encourage you to just kind of reflect and think about it. Ask yourself, how does your agency currently assist zero income clients or clients with no income or low income? I know with COVID, you know, there was kind of this influx of money from all these different programs, which was able to assist people with affording their rents and things like that. But think about what that means long term, and really kind of think about, okay, your agency, you are paying 100% of someone's rent because they do not have income. How does your agency currently help them? What do you currently do? Someone's helping them. And how is that process working for you? Are you getting the outcomes that you need? Is it working effectively? Could it be faster? But I just consider you to think about if SOAR can help improve those processes. And with that, I'm going to end and I'm going to turn it over to Jim. Thank you all very much.
Hey, y'all, it took me a second to find the mute button, but I'm curious before we just jump in, because we do have a little bit more content specific to the supplemental NOFO, but are there any questions about or for Sumitra right now? I know that I have questions for Sumitra that I'm going to follow up about. I think we're going to be working more closely together probably for a while. But any specific questions that came out of the slides or the content that we've already covered? And while folks are thinking about those questions, I'm going to move us along into the remainder of the content for today's presentation. I am curious if you could use the chat feature. Could you tell us if there are folks at your agency right now that have been SOAR certified in the last 24 months? And if so, is SOAR their primary function or a primary objective of the role? And then would SOAR be more effective at your agency if someone was focusing on this model full time and you could pay them with grant funds? And I know we have just a few folks left because I think people may have thought that we were done, but we are recording this. It will go up on the website, so fear not, we will charge on. So I mentioned earlier this idea of the supplemental NOFO. I mentioned this idea of the COC plan. I just wanted to clarify that THN is creating the COC plan on behalf of the Texas Balance of State Continuum of Care. And then project applicants will need to demonstrate that their project aligns with the COC plan. So some of the priorities, there are a number of priorities in that COC plan, but one of them is engaging participants in federally funded or COC program funded projects using the SOAR model to help them gain access to income supports. So, right, like that might look like using a housing first model. You identify someone that is literally homeless, you enroll them into your rapid rehousing or permanent supportive housing project, and then they are assigned to someone whose primary role it is to help them address income stability through SOAR. So we're thinking that could look a number of different ways. Depending on the size of the project and the type of the project, it might make sense for that to be someone whose sole role is income stability. So SOAR, so that could be 100% of that person's staff time, or looking at like the model that Lila had kind of mentioned in Houston, you might decide to share that position with another organization in the community or make that a part-time role. And in that case, 50% or whatever percentage of the time that person is working on SOAR would be dedicated to SOAR, and then the other percentage of time would be dedicated to just kind of like this general holistic case management. I think the thing that we're wanting to avoid in this scenario is a situation where someone has 15 hats and SOAR is able to be put off to the side because it takes so much time and it's so intensive. We're really looking for organizations to demonstrate that they're prioritizing these income supports available through SOAR. So the other thing that we wanted to make sure that we addressed here today is how you will let us know and how you will let HUD know that you are participating in SOAR. It's really funny that we're doing this because this has been a question in the COC application process now for at least a couple of application cycles. I checked and it was present in 2021. It is present in 2022, both in the annual COC application and in the supplemental NOFO. HUD will ask you specifically if there are folks at your organization that are trained in technical assistance related to SSI or SSDI. So we want to talk about where you need to pay attention in the application itself. I see some chatter in the chat, but I'm not sure someone let me know if there's any questions that I need to pause on. So any questions thus far?
Nothing
So we're gonna
yet.
jump into some really technical stuff, okay? When you are in your supplemental NOFO application and you are completing the eSNAPS project application, and I recognize this may be foreign to you all right now because we have not released the RFP. There is a question, however, in the application in a couple of different places where you will need to respond that you are providing the supportive service for program participants in order to demonstrate your alignment with the COC's priorities. So in the eSNAPS project application, both on screen 4A and on screen 6F, HUD asks, do you do you follow up with program participants annually to ensure mainstream benefits are received and renewed? Do program participants have access to SSI or SSDI technical assistance? And has the staff person providing the technical assistance completed SOAR training in the past 24 months? So you will need to answer affirmatively to those questions if that is a service that you are providing. But I want to be really clear that has the staff person, do program participants have access to SSI, SSDI technical assistance provided by this project, subrecipient, or partner agency? For our purposes, we're looking for access to SSI or SSDI technical assistance at the project level. So as the applicant, are you providing this technical assistance? And then again, whether or not they have provided, have completed this SOAR training in the past 24 months. We recognize that folks are not going to be able to get the SOAR training done in the amount of time that we have in all likelihood. So, it would be reasonable for that person, for you to say, no, it's a checkbox, yes or no, in that question. But in the another part of the application, you'll need to talk about why you check that box no. So then on the budget, in terms of how you pay for this cost is allowable as a case management activity. And we have the federal regulation link there at 578.53, section E3, letter 4 or item 4, as an allowable supportive service. So it's part of a holistic case management approach. However, because of the intensity of the time commitment, we do suggest highly that you think very critically about how you structure that supportive service in relation to the other supportive services that you're requesting as part of the project application. Any questions right now? I feel like that stuff's pretty straightforward, although it is, it's, what's the word? It's easy, but it's not simple. How's that? So as a separate part of the application process, in our grant management software platform, SurveyMonkey Apply, you will need to demonstrate that your project is assisting participants to access mainstream resources, and specifically, will the project employ a person whose primary role it is to assist participants using SSI or SSDI outreach, access, and recovery. It's pretty much that simple. Now, I will say that the work is going to come after the fact, right? I mean, we would, if the project goes to award, of course, we would expect that this is something that comes to fruition. But even if the project doesn't go to award, I think that what we can all recognize is that, this is a vital component of helping folks access income stability. And so we want to be here to support y'all, money or no money. Obviously, money's better, but how can we better support folks in rural communities and folks not in rural communities to access and utilize SOAR? When Sumitra reached out, I was like, oh yeah, people, we have SOAR trained people in the Balance of State COC, and I think the reality is that it is such an intensive process that it's easy to put on the back burner and does not happen the way that we would like for it to. And so I guess this is kind of a rhetorical question, but what can the COC do to support y'all in this process? You don't have to answer that right now, but if you have thoughts and you want to reach out to me directly after the fact, you're welcome to do that. That's really the extent of the content that I had, Hope and I had prepared for this presentation. The takeaways here, the headline, I suppose, is SOAR is significantly more effective than the kind of business as usual SSI or SSDI application approach. It's eligible to be funded under the supplemental or COC program NOFO. And we would encourage you to do so and would expect you to do so, given that those three things kind of line up the way that they do. So next steps for us in terms of the supplemental NOFO, barring any unforeseen circumstances, the supplemental RFP for both the rural and unsheltered set-asides will be released in our COC on August the 26th. Before that happens, we would encourage you to consider how SOAR fits into your current and proposed service delivery structure. And to Lila's point earlier, if you're thinking like, wow, this sounds like something that would be really cool with so-and-so, an agency in our community, begin work now on identifying those partners and solidifying those partnerships and your project design. You want to have a pretty good idea about what you're proposing to do come August 26th or shortly thereafter in order to make the timeline work for you. The obligatory note here, make sure that your system for award management registration is active and that you have not let that expire or lapse, because that is a statutory requirement for this funding. You have to meet certain criteria before we can move you forward in the process. But just make, if you haven't already, just check sam.gov and make sure that that looks good before you get too much further down the road. And then reach out to us for support and preparation of the solicitation. If you even if you're not going to apply this time, but would like support in making SOAR a part of this delivery structure in your organization or in your community. We really think, several of us at THN have been SOAR trained in former roles, and I am really excited. It's funny because I think, Sumitra, you were saying, or somebody was saying something about how the process has grown, and it seems so much more efficient and like polished and put together now. It's just really great to see this initiative continue to grow and gain steam, because folks that are experiencing literal homelessness just don't have the same access to opportunity that folks that are housed do, and this is just such a critical way to get them access to income support. So it's really cool to see see it grow, and I'm excited for us to kind of take a more what's the word? To see us taking this step as a COC. So if you have questions, reach out to us, txposcoc@thn.org. You can click in the PDF version of this document, click the link there to sign up for competition updates if you're not already signed up. And before we shut it down, are there any questions right now? I know there's only a handful of folks here still, but any questions? And if not, we can go ahead and shut this presentation down. I thank you for your participation. And like I said, we'll get this up on YouTube and the website later today.
All right, looks like no questions. So I will end the meeting for today. Thank y'all, and we'll see y'all soon.
Thanks, Greg. Thanks, everyone.
Thanks, y'all.